I'd like to talk about healthcare and why we don't have it. Actually, I had healthcare when I was pregnant and when she was born, which was great because that's not the time that you really want to weigh up your healthcare costs and make a lot of decisions. It's nice to know that you're going to be taken care of. The last thing you want to be doing is sitting on your hospital bed or wherever you are, deciding whether you can afford what's going to happen to you. So yes, I was covered and I didn't have to make any of those decisions. And then we came back to the United States. So when looking into healthcare plans, we realized that we could only really consider the cheapest plans, and even that would leave us weighing out the cost benefit for the healthcare plan with what coverage we'd actually receive, and then in the end the huge percentage of my paycheck that would end up taking up for all the family members to get health coverage. So I don't have health insurance, my daughter doesn't have health insurance, my husband doesn't have health insurance, and to my surprise, many people I know don't have health insurance. Their policy is not to get sick. Now, having lived overseas, to me that just seems preposterous. I lived in New Zealand where as a foreign resident I paid taxes, and those taxes went into coverage. I didn't have to make any decisions about whether or not I could afford necessary health issues that would arise if I got sick or if I needed to see the doctor because of an injury. I paid my taxes, I went to the doctor, and as a result I got great care. We are having difficult economic times, and so people make cutbacks, and one of those is coverage for their employees. I can understand that. Businesses need to stay afloat, and so the burden is put on to the employees to find their own plans. It's disguised as choices. Healthcare is disguised as choices. Get the best healthcare that you possibly can. You've got the choices, all the choices that you want for the best providers. Yes, the best providers exist, the best healthcare exists, but only for those people that can afford it. So speaking of choices, one of the choices that we're being faced with is, do we stay living in the United States? If so, how do we get coverage for, even basic coverage for ourselves and our families? In my case, do we move to another country, to my husband's country, and get coverage, know that we get coverage there? We're thinking about having another child, and at this point it's a difficult decision to even decide to have another child, because I want to know that I'm insured. I want to know that I'm covered, and that if I get pregnant it's not going to be a pre-existing condition. I want to stay in California. I want to stay living near to my family so that my daughter gets to grow up with her grandmother and other family members. I want affordable health care, and I want it for my family and for your family, and I don't view that as asking for a handout. I view it as coming together and looking for a system that works, that everybody can pay into and know that they're covered, and not only have a certain percentage of the population covered to know that they're healthy.